Everyone in healthcare has a story that they never forget. Some are beautiful, some are difficult, and most are never told. This is a space and a place where doctors talk about the moments that change them. Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. I'm Dr. David Spiro. Thanks for being here. Please hit subscribe wherever you listen to your podcasts. I'm incredibly delighted and honored to have Dr. Zina Alhaddad with us. She is a double board certified pediatrician and pediatric emergency medicine physician, and she works with us at Arkansas Children's Hospital. She currently serves as the wellness chair of pediatric emergency medicine and is in a fellowship training program at the Andrew Weil Center for Integrative Medicine, which is going to be is part of the future of how we care for children, in my opinion. Her work focuses on bridging evidence-based integrative medicine and academic emergency care with particular attention to physician burnout, nervous system regulation, lifestyle medicine, botanical approaches, and mind-body approaches to the whole person health. She brings an integrative lens grounded in conventional medicine, clinical rigor, and a lived experience in high acuity care. She's also the founder of the Healing Hearst, a physician-led integrative medicine education platform focused on thoughtful, practical approaches to healing, resilience, and sustainable well-being. Zina, welcome to the show.
Thank you, David. It's good to be here.
Yeah, it's great to have you. So would love to get into your story. We all have stories to tell in healthcare, and it's part of the HUMED journey, and would love to hear what story you want to bring to our audience today.
Yeah. I was debating what kind of story to bring on here, because I'm sure, as you know, and you've done this a lot longer than I have, we're always touched by patients and colleagues. There's always a story, and I feel like everybody goes through phases in their life, and every phase is kind of centered around a story or an event that changes you in some way. And that's the beauty of what we do. We learn from each other, but we also learn from our patients. The story I picked for this podcast episode in particular touched me because it really ties in beautifully with the core principles of integrative medicine. Integrative medicine is my passion, and so is pediatric emergency medicine. And I'm striving to kind of connect the two. And this patient in particular hit me because it was in the emergency department, and she kind of changed how I view my encounters with patients. So, I was a third-year fellow in the adult emergency department because, we were supposed to do a couple of adult emergency medicine rotations. And this 55-year-old woman came in with chest pain. And before, in the middle of me taking her history, she just kind of grabbed my hand and said, I know what you're going to tell me. I know what your differential diagnoses are. I just want to tell you, it's not my heart. I know that it is. And, as you're taking the history, it's chest pain, sometimes it's exertional. So definitely raised alarm bells. All emergency medicine physicians that do this, we know that when a patient comes in, there's a certain set of criteria that determines which pathway we go. And she said, I know you're going to tell me you're going to have to rule out a heart attack. And I know that's the responsible thing to do, but I know it's not my heart. So, we did through workup. We went through the motions. We did what every EM physician should do, and we essentially ruled out any acute causes. And she was deemed safe to go home based on her risk factors and her heart score. So when I went back in to tell her, hey, it's not a heart attack, it's not your heart, everything looks okay, she didn't seem relieved. It was almost like a knowing. And she just kept nodding. She said, I know. I told you, mind over matter. That's what she said. And I looked at her and she said, I need you to hear me because you're going to help so many patients. It's mind over matter. It's been my mantra since I was a kid. My uncle told me this. And every time I come into the hospital for whatever reason, I remind myself it's mind over matter. And, I told her, I support that. I'm glad that you did the mature thing. You did the right thing, which is ruling out. acute causes. And, I told her the return precautions and let her go. And as she was walking out, she said, "Don't you forget that. It's mind over matter." And that sat with me for a little bit because, as medical students, we learn about the placebo and the nocebo effects. It's a well documented phenomenon.
Can you talk about that? What is placebo and what is nocebo for those that don't?
Yes, I'm going to try to simplify it as much as possible. So, when we do research studies, a good research study um, constitutes an intervention, which is whatever medicine or treatment we have, and then it's supposed to be against a control group, and usually the control group is given a substance called a placebo, given an intervention called a placebo, which means it's an inert substance or something that is not supposed to have the intended effect we want. And we know that through multiple research studies over the years, that sometimes people respond to placebo. Some people listening to the podcast may know it as, sham surgery, for example, or sham injections, or even saline pills or sugar pills. So it's a substance that's not supposed to have the intended effect that we want it to, and yet somehow it does. Conversely, the nocebo effect is the opposite. It's a substance that shouldn't cause the harm, or something that shouldn't cause harm, but because the mind believes that it does, it actually results in harm. And we, interestingly enough, because you and I, David, work with kids, pediatric asthma, they've done some really interesting studies, and I can't, off the top of my head, remember who the physician was. This was in the UK. They did this in the 1960s, where they brought a group of people who were asthmatic and said, "Hey, we're going to subject you to this noxious stimulus that will cause an asthma attack." And it was nebulized normal saline. And about, I think, 50 or 60% of them had an actual full-blown asthma attack. So what the mind believes will hurt you, sometimes it will hurt you, even if it doesn't have any harmful effects. So that's a nocebo effect.
Yeah, I think when we're in our early learning stages, we think it seems almost crazy to think about the idea that our minds can mimic disease states, but um, obviously the mind is part of our body and is connected. It connects our nervous system to all parts of our body, and we have abilities to be able to change the way we feel based upon how the mind gets set or reset in certain situations. And is that part of the training that you're getting in integrative medicine?
Yes, yes, it is. So one of the cornerstones, the foundations, is they teach you how to have a healing encounter and healing presence. And I think that's something, whether you're an integrative doctor or not, that's something we have to learn or strive to embody, which is healing presence. And I think this fits with your podcast, David. My mantra is, "You are the medicine," right? And that's the core principle of integrative medicine. You and I, as humans, we are the medicine. It's not what we give the patient, it's how we embody healing presence. It's how we present ourselves to the patient, the energy we bring into the encounter, and most importantly, making the patient feel seen and validated. Because, that is their lived experience. Whether or not it's I hate that terminology, but psychosomatic, right? That is their experience. It's real for them. And if we come in with that healing presence, we create the conditions for the body to heal. So it's not the medicines that I give them that heal the patient. It's what I bring into that encounter, the healing presence, but also giving them the conditions to allow the body to go back to homeostasis. And that is the principle of integrative medicine. It's not what we do, it's how we embody the medicine and how we allow the patient to go back to healing.
That's beautiful. So, can you talk a little bit about let's get back to the patient story. So, she's 55. So women who are 55 can have myocardial myocardial infarctions or heart attacks. So how did you approach her? I mean, that was such, it must have been a very interesting encounter where she sort of said, "This isn't my heart. This isn't my heart." And so, like, how did you, from a medical standpoint, like, how did you approach her care?
Yeah. So, and this is a part of what we do as physicians. We try not to impose our personal beliefs, right? So maybe a part of me on the inside said, "Yeah, I think I believe you. Mind over matter," right? But we have to switch on that logical mind, and because we're there as advocates for the patient. And sometimes, I'm sure you've seen this, David, sometimes patients maybe are in denial or they're refusing to believe their diagnosis, right? That's one of the stages of grief. So our job is to, one, I think, hold space for that feeling, whatever they're feeling, whether it's valid or invalid, holding space for it. And I think once we hold space for that, one, they feel seen and validated, and two, it's like, okay, the physician is meeting me where I am. I'm going to try to meet them where they are too. And and I told her, I said, I love that mantra, I really do. But my job is to make sure you're okay. And she said, "I understand that," which is why I brought myself to the ER. My husband told me, "You really need to go." At first I fought him, and then I realized he wants me to do the right thing, which is to rule out an MI. And we know that women unfortunately have atypical presentations. It's not like men, right? They have atypical presentations with MI. So she did
And
what
you
her
say
lab.
MI, just so we're clear, that's heart attack.
Yes, I'm
Yeah,
sorry.
yeah.
Yes, myocardial
Some of
infarction, which
our,
is
some of the folks listening may not be physicians or are in their learning stages. So just to be
yes.
clear.
Well, I appreciate that. But yes, she said, I know the right thing is to rule out a heart attack. I just know in my heart that it's not my heart."
And it turned out that she did well.
She did well. Yeah, she did well. And there's adult medicine. They have these calculators, just as like we do in the peds ER. But her heart score was basically plotted her after we've done all the workup and stuff as low risk, so that she was allowed to go home and follow up with her cardiologist. But at that time, she wasn't it wasn't a heart attack, even though, on paper, it seemed like it was.
Yeah. So what's interesting, getting back to the idea of mind over matter with this, which is what this woman's mantra was apparently. We in the pediatric ER see a ton of children who come in with what we call functional disorders. And I was wondering if you could, and in my career, over the last few decades, it feels like there's more and more children coming in with these things. So functional things like seizure-like activity or pain syndromes that can't readily be determined or discovered by an organic cause. So, can you talk a little bit about functional diagnoses and how integrative medicine might be able to address those? And also, I want to know your thoughts are about why the prevalence of functional disease is increasing as well.
Yes. So in integrative medicine, when other than, the principles of healing presence and a healing encounter and making sure, you're just providing the circumstances for the body to heal itself, we also recognize that you're not just your symptoms, right? And I feel like, unfortunately, sometimes modern medicine can be reductionist in that sense. We treat symptoms. But you're not just your symptoms. And integrative medicine looks at you as a whole person. It looks at you, it takes into account your story. It takes into account your past trauma, your past history. It takes into account where you are in your environment, whether it's with your home environment, where you live, your zip code. And it also takes into account the story that you tell yourself, because again, the story that you tell yourself can help or heal you or hinder you. So when we have these patients that come in with these, functional symptoms, um, one, I think the key is validating it, because for that child or for that teenager or for that parent, that experience is real. right? Their migraines are real, their abdominal pains, their functional abdominal pain is real. They're feeling the symptoms. They're not faking it. The body is very smart because sometimes it just translates symptoms that are actually manifestations of, you know, quote unquote, for simplification terms, ailments of the mind, right? So if something is distressing you in your psyche or in your soul or in your spirit, it can sometimes manifest in the body. And integrative medicine understands that. And it doesn't just say it's in your head, it doesn't just dismiss these symptoms as psychological. They're still real, they're still valid, but the question becomes, how do we address the root cause? Where did that come from? And, that it does involve looking at the patient's home environment, school environment, their mentality. Um, what is it? Sometimes I like to ask, what is the disease doing for you? Right? Because sometimes the disease is serving something, maybe not on a conscious level, but on a subconscious level. What is it serving you? And we know that a lot of kids, like, again, with asthma, once they get admitted, the mind plays a big role in asthma, even in pediatric, especially in pediatric patients. Um, we know that when they get admitted, their symptoms get better even before we start the medications because they're removed from the home environment that's stressful. Maybe the parents are going through a divorce and you remove them from that home environment and then you're providing a little healing space for them and they get better.
Hmm. So, what is your theory about why the prevalence of functional disease and is increasing in our society for children?
Yeah, I think it depends on the disease itself. So, for example, functional abdominal pain, I think it's not just, mind body. I think there's, the gut microbiome is playing a big part in this as well. Our diets, our lifestyle, we're eating a lot less whole food and a lot less organic food, more kind of GMO stuff. And I know that that's a big debate, but, we're not consuming the stuff that our ancestors did 100 years ago. And I think that plays a part. So there might be that kind of factor in increasing the symptoms for IBS, for example. When it comes to other functional disorders, I think that I think in the our current age, we are good at interacting, whether it's through social media or with each other, but we're not really good at seeing people. Does that make sense? We're good at interacting but not seeing people. And a lot of symptoms I think are just a cry for wanting to be seen. I want to be seen. So again, kind of asking, what is the disease doing for you? And it's not like blaming the patient that they're causing that to themselves. No, but what is it serving? Is it making mom and dad see me better? Is it making my schoolmates see me better? Is it removing me from a situation that I don't like to be in? That is a possibility. I think our lives in general are becoming more and more stressful. And especially for kids, I don't think social media is helping. I think it's, um, you know, significantly negatively affecting our kids, unfortunately. That's my
I
personal
I
thought.
I th- yeah, and I agree. I think social media has some component to it, and we're still learning. We're still learning a lot about what we should be and should not be exposing children to, and at what age, in terms of the way that the mind develops. And I think so. There's some wonderful things about social media. Podcasting is part of social media, and this is going to go out on YouTube and Spotify and whatever, and then there'll be shorts around the episode. And you know, uh, there are some good things about social media, but some of the challenges that parents have are around children engaging with devices at a very early age. Sometimes I see children who are a year, 15 months of age, they're holding a phone, they're interacting with a phone, and I wonder, what does that happen? And then you take the phone away and they cry. So it's almost like a pacifier, and it doesn't just relate to children. I think I've been working on how to figure out to put the phone down, not have it next to me when I sleep at night, I don't need to be checking email 24/7. And I think it's not just a pediatric thing. I think it's an adult thing as well. That we all had this explosion of cell phones in our lives. For me, I grew up without cell phones, so I had a before and then after cell phone land. And now I want to get back to how do I tone it down, and because that cell phone is a gateway to the world, literally. And I want to get back to the calculus of being and attending, and then uh, deciding to study integrative medicine with Dr. Andrew Weil. And I know you go to Arizona to take courses and to be involved. What It's a very unusual uh, combination of expertise as a pediatrician and a pediatric emergency medicine physician, and then all of a sudden now you have this other piece, these other tools that we didn't learn in medical school around integrative medicine. So for the audience of those who are learners, what made you decide personally that you wanted to dedicate your time to studying this discipline?
Yeah, so it started early in med school. I think I was uh, probably a second year medical student. I had a thing that conventional medicine said, "Yep, it's gonna be something you're gonna have to deal with it for the rest of your life." And one can argue as a young, stressed out medical student, it could have been functional, right? It could have been functional, but at that time, the doctor comes in with their white coat, and I'm just a young medical student. There's authority in that. And that's another thing about the placebo and nocebo effect, that and maybe we'll talk about that later in this episode, but we hypnotize patients whether we like it or not. The second we go into that room, the patient's hypnotized. Especially kids, they're so prone to suggestion. So I was told that by the time I'm 33, I'm going to have surgery to get that thing done and fixed. And well, I'm 35 and I never had to get that surgery done. But, at that time to hear that as a medical student, like I could say I was diagnosed with carpal tunnel, right? Which is like unusual for a 20-year-old. And I was told, by the time you're 33, you're going to come back to see me and I'll do your surgery. And I remember, as a stubborn young medical student, I said, nope. And I didn't like how I felt. It was not a healing encounter. I was told, I take too much notes and, you're constantly on your phone and stuff like that, or your computer, which I'm like, yeah, I have to take lecture notes. So, I did the medical thing, which I got steroid injections in my hand because those, there's some evidence that helps with pain and numbness and tingling. And I would wake up in the morning and notice I can't hold my cup of coffee. My hands felt really weak. So I did some digging as a young medical student. I said, what are some other causes? What are some things that I could do? And one of the things that came up is something called emotional freedom technique. It's called EFT. And I don't know if you've heard of it before. And
Mm-mm.
for the listeners, it's basically this, it's, unfortunately, a lot of conventional doctors kind of dismiss that as pseudoscience, but there's actually some evidence behind it, especially in people with PTSD, people with migraines, people with OCD. It actually helps somehow, some way, kind of modulate that psychological component of things. And it could help with chronic pain. So I gave it a shot. And I tried it a couple of times. And then over time, I noticed, 6 months in, I was no longer having my symptoms. I was waking up in the morning,
Wow.
no reduced grip hand strength. And, one of the things that kind of came up with it is because there is a lot of, again, you said mind body. When you're tapping, kind of emotions rise and you're supposed to, you know, target those emotions, tap on them, kind of resolve them. Because again, sometimes the mind manifests as symptoms in the body. And, it went away. And I was at that time, I was shocked. Again, it could have been the steroids, it could have been a placebo. We don't know. But it led me towards like a different path where I said, okay, there's a little bit more than what I'm being taught in med school. There's a little bit more than about just the injections and just medications and surgeries. And, you know, uh, I knew I was going to do a integrative medicine, and I was interested in both peds and family. I applied to both, and kind of sometimes the universe steers you in one direction. And I ended up in peds, and I'm very happy with that, and realized I really love the peds ER. But even 3 years into becoming an attending, I've at that point I had been in ER for several years. I still thought about integrative medicine. There's still a part of
Mm.
me that was like going back to that experience. And of course, noticing that I'm not always helping patients. When a patient comes in a trauma and, or a wound or a broken bone, I want to be there because you and I know how to fix it. I want a trauma surgeon to be there. We know how to fix that. That's fixable when there's a surgery or a trauma that needs to happen. But when there's ailments, chronic illnesses, pain, psychosomatic, psychiatric, functional, things that affect our day-to-day life that our patients experience on a daily basis. And you know that, David, right? We see so many kids in the ER with functional syndromes or symptoms that are real that don't have an organic cause, and yet we don't know how to fix it. There's that piece that's missing. And that's what, I went back to integrative medicine. And as I'm studying this stuff right now, I'm realizing there is so much we could be doing for our patients, not just medicines. That's more, that's, coaching or supplements or whatever, that could be helping them tremendously.
So I'm imagining that in an integrative medicine clinic, which you may be participating in the future, and Arkansas Children's has started one with Dr. Yu, who's been a guest on our episode, one of our earlier episodes, um, and is phenomenally busy. It's already full, and they want to expand it. The integrative medicine sessions, I'm imagining, are not 10 minutes per child. They are probably 30 minutes or an hour in length. Is that fair?
Yes. So it depends on the physician. Most of my colleagues actually and my mentors in the Arizona program actually do 90-minute intakes. 90,
Wow.
90.
Wow.
Yeah, especially the first session. You really want to get
Hmm.
into that patient's life story. You want to know everything. And it's not enough. It's often not enough.
So let's talk about the dichotomy of you being a pediatric emergency medicine physician. You've been an attending and fellow for 6+ years, and now you're experiencing integrative medicine. How do you see? So there's that juxtaposition of the 90-minute visit, and part of the uh, realities of pediatric emergency medicine is we have patients that wait and to be seen. And so part of the job is to see patients, spend the right amount of time with them, and then get them onto their next station. And I oftentimes think of us as dispositionists, that we're trying to figure out where patients go, because the ED folks don't live in the ED. Some do, but most don't, and they go home. So how do you think about, because you must be one of the first folks in the country that is a certified pediatric emergency medicine physician, and now getting certified in board certified, and now getting certified in integrative medicine. How do you see integrative medicine, you know, uh, transecting our world of pediatric emergency medicine?
Yeah, I think, if it was up to me, I'd say everybody needs to be trained in integrative medicine. Really, every physician needs to be trained in integrative medicine because I think it's the
Mm.
future of medicine. But it's fascinating because I could see, it's almost like you said, dichotomy is a beautiful word because there's almost like two parts of my brain. There's the ER brain that says treat and street. Because you're right, patients can't live there. And unfortunately, we just don't have the privilege of time to sit with a patient for 60 minutes. Because, there's traumas coming in and really sick kids that need our attention immediately. So, within the first kind of 5 to 10 minutes of speaking to somebody, then you realize, okay, this is acute versus chronic. this is something that I can fix today in the ER versus this is not something I can address today. So how does that fit in? I think, I think that one, recognizing that there are limitations to what we could do in the ER. There are certain things I could do as an integrative doctor in the ER that are quick and easy. And I think I've told you about some of them. I've been able to help so many kiddos with neck spasms, with a couple of OMM, manual therapies, so like suboccipital release, and I was able to send them home with no medications, and that's a big deal because if you look at the standard of care for a kid who comes in with a neck spasm, what do? You do NSAIDs, so Tylenol, ibuprofen, and sometimes an Ativan or a muscle relaxer, right? A benzodiazepine or a muscle relaxer. So being able to take a
Which
patient's
has
pain,
side effects.
yes, has side effects, and it's not without its harm. And to be able to take a patient who's a child from a 10 out of 10 pain to a 1 out of 10 pain and see them, coming in stiff, not moving, to fully ranging that neck is so satisfying. And I could do that in 10 minutes, as I could do that in the ER in 10 minutes. But there are things like you said, chronic pain, chronic abdominal pain, our kiddos with sickle cell who are constantly coming in with pain crises. There's some really strong evidence that integrative medicine helps. We just can't do that. We can't do that, unfortunately, in the ER. There's not enough time.
They can be referred if we have an integrative medicine clinic within our health system. They can be referred for a longer clinic visit where they can actually you can get to potentially the root cause of what is causing this issue.
Yes.
So we had a guest on recently, Dr. Michael Malofsky, very interesting gentleman who has morphed his practice into more of a concierge or direct primary care practice, and he actually does home visits. So is there a component of integrative medicine that there are home visits? And he feels strongly about it because he gets to experience what the family is really like in their home environment. Of course, the emergency department and even an integrative medicine clinic is an artificial, or the hospital's an artificial construct. It's not where the child usually lives. They have a
Yes.
life outside, and we're taking them away, as you referred to earlier, when things get better when they're away, but it's not necessarily reality. So
Mhm.
what are your thoughts about home visits?
Yeah.
Have you thought about it at all?
I have. It's interesting because that's
Uh-huh.
how physicians used to do it. 200 years
Yeah.
ago, you used to be the
100
physician in
years
town,
ago. 100 years
right?
ago.
You used to be the
Yeah, yeah.
physician in town and you would do everything. You would be the family doctor, the pediatrician, the OBGYN, the surgeon, and you would go to home calls and, deliver a baby and then go to a sick grandparent who's, dying. You would do all those things as the town doctor, and now we're just so specialized. And a part of me does romanticize that aspect of medicine, that I romanticize that aspect of healing because like you said, you're it's not enough to see the patient, you have to meet them where they are. And when you're going into the home, you're seeing, like you said, their home environment, and that plays a part into their symptoms. If I walk in and all I smell is cigarette smoke and I'm here for an asthma attack, maybe I know what's going on. Or if it's somebody with, functional abdominal pain, and you notice that maybe the home situation is lacking in whole nutritious foods, and maybe there's something to say here. So I do think that I think home visits, if that is the future, that would be wonderful. But I think home visits will definitely make for better care. And to answer your question about integrative doctors doing this, I personally don't know any of my colleagues that do this in integrative medicine, but a lot of them are moving to concierge because they recognize that, I might have a smaller pool of patients but I can dedicate more time to them. That means, not that you're they're on call or on demand doctor, but you're accessible to them. You can spend 90 minutes with them and have very tailored, individualized management plans, and that makes them feel seen and not just dismissed. And that's what you hear a lot from
I get it.
patients. Like, doctors come in for 10 minutes and then they leave, right? We don't want to do that. We really don't. We want to spend time with you, but we just can't.
Well, it's clear that you're passionate about it, and it's such an honor to have you on the show because you are the first that we know of pediatric emergency medicine boarded physician attending who's actually investing time and energy in um, a discipline that is sorely needed in our populations. So we'll wrap it up. Zina, it's been an honor and a pleasure to have you on the show. This has been a very interesting discussion. Thank you for bringing a story to us. The discussion's been fascinating, and I just want to thank you all for listening. This is Dr. David Spiro. Please hit subscribe. We're now at 13,000 subscribers. Maybe when this is taped, it'll be higher. Should be, but we really are on a little bit of a roll, and I think we're resonating with people like Zina that we're bringing on. So please hit subscribe, and you can also see me on Instagram at HuMedPod as well. And I just want to thank Zina again, and I hope everyone has a great rest of the day. Bye-bye.
Thanks for listening to HuMed with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.